February 10th, 2026. I'm Dr. Deukmedjian, and we are getting ready to perform endoscopic transforaminal lumbar surgery in a patient who traveled here all the way from Canada. He's here with his father-in-law, and he's here because he has a herniated disc at L4-5 disc herniation with an annular tear. He's been suffering in pain for over a year and found Deuk Spine Institute online. We did an MRI review. I found that his pain was mostly coming from L4-5 disc on the left. And based on that diagnosis, we recommended the Deuk laser disc repair. He's here now. Our first patient from today is doing better. She had complete paralysis of her foot. She's now moving her toe. And she says the pain in her back and down her leg is gone. She just has some soreness. So hopefully she'll make a recovery. This patient is our second case for the day. He's a left L4-5 Deuk laser disc repair. Henry, let's show the audience how does a herniated disc cause so much back pain. What's the mechanism that happens?
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. Our patient is from Canada, and you've just watched our video on how herniated discs actually cause so much back pain. We're trying to get our x-ray machine lined up perfectly with the spine. I think that's looking a little better there, Jordan. Maybe we can improve it just a little bit more, but we're going to be entering the L4-5 disc from the left side using a needle called a spinal needle. Once we're into the disc, then we can repair it with the laser, but we've got to get there first. You can see the needle there, shot. So I think that L5 is really rotated on orbit. Can we de-rotate it? You see what I mean? I could be wrong. It could be just a wag issue. It could be just a wag issue. What do you think, Jordan? I almost feel like it's a wag. Oh, that's worse. Let's come back the other way. So it's very important, folks. We're using an x-ray machine to navigate. All right, do you see? Let me just show you. Do you see the back of the L5 vertebral body, Jordan? You see, that looks like one pedicle and that looks like the other. So I think we're off. And we need to bring that over to there, if that makes sense. So it's a pretty good rotation. He's got really bad scoliosis, folks, right at L4-5. That's, I think, a lot better, right? Is it? It's very hard to tell. Keep playing with it, Jordan. See if we can't get it better. If you have questions, feel free to ask. Go a little bit more. Yeah, he just has a really bad scoliosis there. That's quite interesting. No, it's worse. We got to fix it. Can you go the other way? Maybe try the other way. More. More. Yeah. That's better. Keep going, just a smidgen. Maybe we overshot it there. I mean, we're definitely off on orbit at 4, but I feel like 5. Maybe May not be there yet. Maybe go a little further. Let's just see if we go further what happens. More. Yeah, we're definitely going the other direction now. So we shot past it. Let's go back. And back a little more. Yeah. Well, 4 looks almost perfect. Go a little bit further. But it's 5 that's so rotated. I think that's going to be the best we're going to get it right there. That's really interesting. It's not what I expected based on his MRI. Shot. Shot. Give me an AP, please. Very bad scoliosis at 4-5. As seen on the x-ray. How are his hips and everything? His pelvis? Wow. Look at that. That's impressive, huh? How much rotation there is there? Yeah. Shot. Well, I'm hitting bone, so I'm not seeing where that bone would be on that x-ray. Maybe the inferior end plate of 4. I think it is. So we're just trying to get our x-ray machine lined up with his spine so we can do the procedure. It's his anatomy is just so abnormal. All right, we're in. I think that's as good as we're going to get it there, Jordan.
How you doing, my friend? You okay? Open your
Shot.
eyes for me. Good. Can you open your eyes for me?
All right, that's fine, Dr. Berndes. Yeah, I think I'm happy with where we are here. No. Henry, let's show the audience. You got to keep the videos moving, Henry.
Yes, sir.
Shot.
Show the audience of how it is that we cure a herniated disc.
Pain from a herniated
Pain
disc.
from a herniated disc.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Get rid of back pain that comes from a damaged disc. That's very simple. It's called the Deuk laser disc repair. It's endoscopic. It's done going through a 7mm incision, which is what we're doing on this patient, who traveled from Canada. We are now went right through the herniation, pushing the herniation back, and now we're going to remove pieces of herniation out of the annular tear in the back of his disc, called the posterior annular tear, by using a laser and an endoscope. The endoscope allows us to see the annular tear and herniation. The laser allows us to remove fragments of herniation and debride the annular tear. So this surgery is not possible without the endoscope. Okay? And it's not possible without the laser. Any questions from our audience?
Yes, we have a question coming from Bobby on YouTube. Asking, how come you're the only one doing this? Why aren't other doctors interested in doing this? Thank you.
Well, first of all, this is a very difficult surgery to do. It's far more difficult than fusions, laminectomies, artificial discs, any other type of spine surgery done for degenerative problems. It's the most advanced spine surgery we do. So the doctors, number one, they don't know how to do the surgery because they haven't been trained to do it. Number two, they don't want to learn how to do the surgery because it takes a year or two out of their life where they have to leave their practice, come to Deuk Spine Institute, learn the surgery from us, and then go back home. And during the time that they're here, they don't get paid. So spine surgeons usually make anywhere between $500,000 a year to $1 million a year on average. So if you're making, say, $750,000 a year, and then you have to leave and learn how to do this surgery for 2 years, and you don't get paid, then your family gets no money, you get no money, your practice goes out of business while you're learning how to do the surgery. So there's a very strong disincentive for doctors to do this surgery because they don't want to take the time out of their busy schedule to go and learn a new treatment. That's why. And the only place they're going to learn it is here. So it's not like they can just go down the street and, do a few cases and pick up a new set of surgical skills. Also, the payment the surgeon gets for doing this kind of surgery is very low. We don't get much money at all. Most of these cases, I don't get paid any money. I make nothing. So I'm doing them for free. And most surgeons don't want to work for free. Also, the equipment you have to buy to do these surgeries costs tens of millions of dollars. If you want to set up a center to do this kind of surgery, you're going to spend in the United States $20 million to $30 million. So you got to borrow that money. Banks don't want to loan doctors money anymore because doctors have a hard time paying those loans back. Okay? So there's a lot of reasons why doctors aren't doing this surgery that includes mostly financial reasons. Okay? But the number one reason is they don't know how to do it. It's a new advanced technique that they weren't trained to do. I wasn't trained to do this in my training, and I went to the number one neurosurgery training program in the world at the time that I got accepted in 1996, 97, that era. That was the University of Florida in Gainesville. And they didn't teach us transforaminal, endoscopic, laser-assisted annular debridement. I had to pioneer this technique myself. And over the years, we published it, presented it at national meetings to neurosurgeons. And people love it. They think it's fascinating and interesting. However, they just can't do it because they haven't been trained. So they don't have the equipment, and they don't want to take the financial loss of doing the surgery. I don't mind taking the financial loss because I've already made good money in medicine, and for me it's more about helping people with the right surgery rather than making lots of money. I have different priorities in my life at this point. I've been in practice now 30 years, 22 years on my own practice, and I just like doing what's right for patients. I have a different philosophy than most doctors. All right, we got some blurriness here, Luis, that is not correcting. You have another scope? Why don't you grab it? So we have done now at Deuk Spine Institute 2,700. This is our 42.
43.
Sorry, 2,743 cases. This is our 43rd case. 2,743rd case. It took me probably at least 50 cases to get really good at the technique. And then it took hundreds more to really perfect it. But we've been doing this surgery now for 20 years. And Luis, you've been helping me for what, 11 years?
Yes, sir.
Any other questions?
At this moment, no current questions. So in the meantime, why don't we show the audience the 30 causes of back pain?
I think that's a great idea, Henry. You've been here 4 years.
4 years. Going on 4 years.
Yeah, you and Berndes both. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You can see in our video that we use a laser to repair the disc, and that the disc is the most common cause of back pain, and that's what is causing this patient's pain. Okay, we're done with the herniation, and we're going to be waking our patient up in just a few minutes. I know we have some questions.
We have a question from Eric on YouTube
Sure.
saying, a year ago I completed my MRI review with you. You're amazed that I'm still walking. Also last year I was diagnosed with non-celiac gluten sensitivity. Should I work on my diet before this surgery?
Yes, I think that's a great idea. You don't need anything complicating your recovery from spine surgery like a GI issue. So you got to get that diet down, and then when your body is used to your new diet and your GI tract is working optimally, then you come and get it done. All right, we finished L4-5 Deuk laser disc repair. You could see in that patient's disc that there was some grungy material, that was scar tissue, calcium from years of inflammation going on in that posterior annulus. And the incision here is just 7 millimeters, quarter inch, the size of a Band-Aid. We should have a Band-Aid, a sterile Band-Aid. That would be kind of cool, huh? I don't think you can sterilize a Band-Aid, though. That's the only problem. Is Band-Aid sterile when it comes out of the package?
I think so, yeah.
It'd be great to know.
Yeah.
Then we could just pop one down so people can see the Band-Aid and go, wow, that's so small. But instead of going the traditional route of going straight through the back, where you go through the bones and ligaments, remove them to get to the disc problem, we're coming from the side. And Dr. Parvis Kambin was the first surgeon in the world to do that. He was in Pittsburgh. He was a professor of orthopedic surgery. And he developed the first transforaminal endoscope that went from the side through the foramen without removing bone and ligaments. Unfortunately, his technique had a lot of complications because he was the first to do it, and he wasn't a neurosurgeon. So he didn't really understand where the nerve was, and he would damage the nerve a lot. With us at Deuk Spine, we've never had a single case of nerve damage in 20 years. And our patients do very well. We've had no surgical complications to date. Thanks for joining us. We'll be back shortly with another surgery in about 20 minutes. This patient's going to go home in 30 minutes. And good morning, I'm Dr. Deukmedjian. 30 years of back pain.
Yes, sir.
gone overnight.
Yeah, overnight gone. It was amazing. I've been dealing with it, suffering. If it wasn't for my faith and belief and my friends back home that supported me, my wife, I finally got here to the Deuk Spine Institute, and what an amazing experience it's been. Had surgery yesterday. I'm up walking around. I feel great. My pain was usually from a 6 to a 10 out of 1, if that. And I'm just so grateful that there are gentlemen in this world that really care about people like Dr. Deuk, and I can't thank him enough. I recommend this gentleman to anyone who's been suffering and doesn't know where to go for help. You know, I live in the state of Idaho. It's a great place to live, but probably one of the worst states to get hurt in.
Well, we are happy you're here in Florida to get your back fixed. And we did the Deuk laser disc repair on your back and the Deuk plasma rhizotomy on your facet joints. And you had a fusion done before, is that correct?
That is correct.
And we saw in your video when we were doing your laser surgery, you could see all the screws and rods, and you even have a broken screw at L5 on the left side, I believe. How do you feel comparing your fusion surgery with the Deuk laser disc repair?
There is no comparison. 100% different. The fusion didn't help me, made me worse. It gave me a heart complication that I still deal with. But since I've been here, the people are outstanding in this facility, and I can't praise them enough. And Dr. Deuk is truly a godsend for people that are suffering. I can say 100% honesty that I feel totally different person. I'm just so glad that I came here.
How does your wife feel about your new back?
She loves it because she knows I've been dealing with pain and depression. It's a hard thing to deal with. You know, it almost took my life. But like I said, with my belief in our Father and His Son, Jesus, has kept me here.
Amen.
And she's a big part of that. You know, I got to thank my friends like Dave Bowden, Dan Arnold, and Brad Russell. Those are truly my childhood friends that never gave up on me. People judge me on how I look, not how I am. And I'm a very compassionate person like yourself, and I want to help other people. I can't suggest Dr. Deuk and his team here are world-renowned, outstanding, and everyone's so kind. I'm just so happy, you know, to have you on my side, and I can't thank you enough. You know, thank you, sir.
Praise God.
Amen.
And thank you for having faith in my team and our ability to help you.
Yeah, it is. It's they're, like I said, they're world-class people here. You can't go wrong. At least for myself, I'm just ecstatic. It's, you know, can't put it into words when you have no pain. I love it, and I'm just so glad that everyone helped me who was involved with me getting here, because I didn't do it on my own. I thank you all.
Well, thank you for sharing your story. I know it means a lot to people out there. We just want people to know that we can now fix back pain, neck pain. They just have to come here to Deuk Spine and get the right treatment done, and we'll help them tremendously. Enjoy your travels home.
Yep.
And enjoy your new back.
And I shall. Thank you so much.
Yes, sir. It's my pleasure. All right.